everybody. My name is John Blanchard, and I'm a family physician here in Michigan. Again, I'm doing these videos to try to get good information out there about the COVID virus and help people get through this. I'm living in the COVID camper. This is where I'm living so that I don't bring this virus home to my family. I work for a practice called Salta Direct Primary Care, and for those of you who don't know, Direct Primary Care is a model of primary care where people can hire us on a monthly basis for $90 a month to provide them a comprehensive primary care service and giving them enhanced access to their provider. We'll talk a little bit more about that later. In these videos, I cover some questions that I'm getting about the COVID virus. Then I talk about one thing I'm grateful for. Again, that process of mindfulness, looking for positive perspectives, and gratefulness is very important, especially during this time. I also cover something that I hope is positive that comes out of this experience. And then finally, I talk about how Salta Direct Primary Care works for me, as why I like being a direct primary care doctor. So let's talk about the questions. So one of the questions that we're getting is, can I get COVID again? There's a lot of misinformation out in the internet right now about this question. Right now, we don't know for sure what kind of immunity the body's going to mount in response to having COVID. So we know that with other viruses, other viral illnesses, that the body usually develops an immunity and you don't get the virus again. That's likely going to be the case with COVID, but we're going to have to track that and find out how that pans out. For right now, the answer is we're not sure, but probably you're immune to it if you've had the COVID virus. The next question is, what does the COVID virus do to your lungs? Well, we know it causes pneumonia. It causes fluid accumulation, inflammation in the lungs like other types of pneumonia. That's why people get difficulty with breathing. One of the questions people have is, if they get an infection in their lungs with COVID, will they have long-term lung damage? And the answer to that is that we're not sure. There could be scarring that occurs in the lung because of the inflammation, and there could be long-term issues related to that, but that's something that we're tracking too, and may not know for some time until we see how this pans out. A big question we're getting now that the COVID virus is circulating more in the community, more and more people are knowing people who have COVID, maybe even family members. And one of the questions is, if they're isolating in the house, if they have COVID, how long do they have to be isolated for? So if you have a family member who is diagnosed with COVID, or maybe they're even in the hospital, people have asked when they come back from the hospital, how long do we have to isolate from them? Right now, the CDC recommends that you can stop isolating after you meet 3 criteria. So first, the fever has to be gone for 3 full days, okay? Number 2, the symptoms have to be getting better. The coughing, that kind of thing has to be getting better. And 3, it has to be 7 days since the first onset of symptoms. We think that for most people, once they've met those criteria, the likelihood that they're shedding the virus in large amounts is very low. Now, we do know that the body can shed the virus for even weeks after the illness, but the most viral shedding occurs primarily during the acute phase when the person's really symptomatic, having fevers and coughing and that sort of thing. Once the body's immune system responds, it is very good at killing the virus and decreasing the ability for the body to shed the virus. One of the things that I'm grateful for is not just the healthcare providers, not just the physicians, but all of the nurses, all the administrative staff. Think of all of the people who are associated with the healthcare system to keep these hospitals open. They're working a lot of hours. They're putting themselves in danger. I'm really grateful for those people. And it's not just them, but it's everyone who's working, who's supporting society today, all of that critical infrastructure, the grocery stores, the truck drivers, the police officers, the firemen and firewomen, they all are contributing during this difficult time for us in society, and I'm so grateful for those folks. One of the positive things that I hope comes out of this is that one of the things we're seeing with this COVID virus is the number of emergency room visits for other things has really dropped off. One of the big problems we have in our society is people are going to the emergency room for things that aren't emergencies. They're going there for sore throats and coughing and problems that really should be addressed in a primary care setting. So I'm hoping that this experience helps people realize that the emergency room is for emergencies. It's for when you really have a problem and you need to get that addressed right now. For everything else, you should be trying to use your primary care provider. And that's why it's so important that you have a primary care provider that you can get a hold of and that you can get in and get seen for things that are urgent but not emergent. And that's, I guess, goes into my next comment, which is why I love being a direct primary care doctor. Unfortunately, in today's healthcare system, we're moving to a one-size-fits-all system. And people have to conform their needs to the system instead of the system conforming to their needs. In direct primary care, we bend the healthcare delivery system around the patient. So if people need a phone visit or they need a video visit or they need to be seen in person, we accomplish all of that. We can get people in same day. There's no waiting in the waiting room. They get right into the exam room and they're seen, and the visits are more lengthy than in a traditional setting. If you need your provider, they're there for you 24 hours a day, 360 days a year, where you can just reach them right on the cell phone. And it's that types of access that I believe can really reduce the number of emergency room visits that are unnecessary, and we've been able to prove that in studies. And it's one of the components that results in our primary care delivery system. The direct primary care model has been shown to reduce overall healthcare costs by 20 to 40%, because we deliver the right care to the right people at the right time and place for the right cost. And that results in great savings financially for companies and even for people that have, for example, high deductible plans. They want the best, most efficient and cost-effective approach to the care that they get, and we're able to provide that in direct primary care. So again, thank you for watching this video. Stay safe out there. Love each other. Follow us on Facebook at facebook.com/saltofclarkston, facebook.com/saltoftroy, or visit it or call our Kyle at 248-922-3076. He'd be happy to answer any of your questions about joining the direct primary care practice, Salta Direct Primary Care, and answer any questions that you might have from a company's perspective. If anyone has a business or a company that's interested in providing a direct primary care benefit for their employees, we're also ready to talk to you as well. So thank you very much. Again, love each other, and we'll see you again shortly.